The National Agency for the Control of AIDS, Naca, works to provide an enabling policy environment and stable, ongoing facilitation of proactive multi-sectoral planning, coordinated implementation, monitoring and evaluation of all HIV and AIDS prevention and impacts mitigation activities in Nigeria. You are watching The Last Mile with Naca. I am Adesua Osui. This episode showcases activities that reflect some of the mandates of Naca, starting with a recent meeting of the National Prevention Technical Working Group in Kano. Don't go away.
The National Agency for the Control of AIDS, NACA, established the National Prevention Technical Working Groups to coordinate joint planning and technical support for critical issues on HIV and AIDS interventions, with a mandate to provide technical support in the delivery of a coordinated and effective national HIV prevention program. The National Prevention Technical Working Group, consisting of representatives of relevant ministries, departments and agencies, implementing partners, civil society, community and faith organizations, held a session in Kano State. The objectives of the meeting was to take updates and report on the status of HIV prevention programs from partners and subcommittees of the National Prevention Technical Working Group and states in the Northeast Zone, to identify gaps and steps of action, to develop the National Prevention Technical Working Group action plan and priorities for the first quarter of 2023. Some participants shared their thoughts.
What the group does is advisory to the government. It is constituted of very key stakeholders in national response, including donors, relevant ministries and departments and agencies of government that have a role to play in the national response. Also have implementing partners. They also have academia as part of it. And then while we rotate, we try to also make the leads of both the response and then the health sector response in the various states. I'm talking of the state agencies for the control of AIDS, and then the SASCAPs to be part of the meeting. We also bring in the network of people living with HIV, their representatives, civil society organization, and our key population networks. So now you are bringing people who are in the field, people who implement, people who donate, people who do policy, looking at the prevention of HIV holistically. So at the end of every meeting, we usually come out with a communique that advises government on how to better position the response.
Part of why we are here is because of a special population, which is called PWID, people who inject drug, to see how we can build our capacity from NACA end. And because we have our roadmap that we work with, we call it NDCMP, National Drug Control Master Plan 2021 to 2025, which equally talk about issue of health and security of all Nigerians. And the reason why we say, okay, we have to partner with NACA, another implementing partner that are in the field of harm reduction, to see how we can bring it on board and to assist those who are using drugs or those who are injecting drugs, so that at least we will have the knowledge of how to take care of them. If there's any issue with their health, how to go about it, because this has to do with issue of public health.
So APIN implements among key populations. We implement among adolescents. We also implement among the general population. And we implement prevention, treatment and care programs. So we have the OVC program, we have key population program, and we have programs targeted at pediatrics, adolescent, and the PMTCT. And so we're here at the Prevention Technical Working Group meeting to share what we have done in the third and fourth quarter of the year 2022. And we're here because we're accountable to the government so that the government knows what we're doing. And we're also here to present new learnings that we have. And as it is, the Prevention Technical Working Group, not only us, other IPs are presenting, we're also learning things from them. So it's a kind of cross-learning environment that is provided, and also getting to know what is new within the space of prevention of HIV in Nigeria.
The Prevention Technical Working Group is about advising the national response that is housed in Naca about the HIV prevention programming. And because UNODC is among the stakeholders that see about certain key populations in the HIV response, it just made sense for us to be here. We also know that the Global Fund project for UNODC is to provide technical assistance to Naca. So that makes us fully part of this activity, just so that we are able to provide the needed technical assistance when it comes to those areas that, we work with Naca.
We all know festive period is a time to loosen up. We all have fun, lots of hangouts.
However, statistics show increased indiscriminate sexual activities over the holiday period.
Unfortunately, this also means more people are getting sexually transmitted infections.
One gift I will never love to get during this festive season is that of HIV infection.
So, celebrate this holiday responsibly and with caution.
Avoid anything that can lead to new infections, impacting the progress made in the fight against HIV and AIDS.
Your New Year resolution should include knowing your HIV status.
Get tested for free today.
Bruv, babe, share love and not HIV infection.
Next is a NACA-supported training organized by the Association of Women Living with HIV and AIDS in Nigeria, ASWHAN. Stay with us.
The Association of Women Living with HIV and AIDS in Nigeria, ASWHAN, recently organized a 4-day training and advocacy workshop for mentor mothers on the uptake of prevention of mother-to-child transmission of HIV and early infant diagnosis services. The closing ceremony had in attendance representatives from Naca, the UN systems, and relevant organizations. Welcome remarks were delivered by the ASWHAN National Coordinator, Assumpta Reginald.
The ongoing National Strategic Plan is moving forward to plan for the elimination of mother-to-child transmission. This is an extremely good development. We are, however, still far from this vision. In 2020, prevention of mother-to-child transmission coverage was at 7%. The uptake of AMC, facility delivery, and early infant diagnosis coverage is still very low. Mentor mothers need to be developed as a national program with all systems and structures to support its implementations. The USAID localization agenda, PEFA, Bill and Melinda Gates, and the Global Fund all speak to the need to strengthen community response and ensure community owns their response. If there's any place where the realization of this localization agenda needs to be granted in Nigeria, it is with the PMCCT program. ASWHAN is a willing partner. We have been doing and we continue to do what we know how to do best. Support women living with HIV to live high-quality lives with family and children. As a community of women living with HIV, we challenge you all to stand up and translate Mentor Mothers project in Nigeria into a program led and owned by the community.
There were goodwill messages, including that of the Director General of Naca, represented by the Director, Policy, Planning and Coordination.
The Mentor Mothers program, I must say I'm privileged. I knew exactly when that program came into the country. The first meeting was held at Naca. I am so proud to see what the program has become. And I want you to know that the role you play is extremely significant. In fact, for every newly diagnosed pregnant woman, you are more important to that woman than the doctor. So in the national strategic program that we're working on, PMTCT has always had its pride of place. But now we're not just talking about PMTCT, we're actually talking about EMTCT. And as usual, we're giving it the priority that it deserves, and we're coming up with the national targets and what have you. But for us, it's not just to design something. We actually want to work together with partners to achieve the desired results for Nigeria. Unfortunately, the HIV Trust Fund is focused on PMTCT. So I believe that we have all it takes to achieve what we want to achieve. You can be very sure that Naca will provide all the support necessary.
We are aware that there's a lot of gaps, there's a lot that needs to be done. That's NASCAP and a lot of people in this sector have told us. And I know that ASWHAN has been doing quite a lot as mentor-made mothers, even going beyond the call of duty. It is women that actually makes the world tick. And unfortunately, we have still not achieved the goal of gender equality and women's empowerment. But as UN Women, we give our commitment to continue to support everything that has to do with women, girls, especially those who are usually left behind. So we want to thank everyone once again and to give you our continuous support that we will continue to do this. All we continue to ask for is the cooperation of ASWHAN and their leadership so that we continue to do the much we can do.
Over time, ASWHAN has benefited from both technical and financial support from UNAIDS towards achievement of its mandate. One of such support provided is in the engagement of mentor mothers across 6 states of Nigeria as part of efforts towards removal of barriers to accessing PMTCT and EID services. This was funded by the EU-UN Basket COVID-19 Fund. It is such a delight to observe that this initiative is being scaled up with the just concluded training of mentor mothers. The role of communities in ending AIDS as a public health threat cannot be overemphasized. We will therefore need to sustain advocacy for improved funding and for technical assistance to ASWHAN and other related community and KP-led networks and organizations for greater impact and better outcomes in Nigeria.
Prevention of maternal-to-child transmission of AIDS and the 16 days of autism aligns with the 3 transformative agenda for UNFPA. 2 of them is about ensuring that we have 0 maternal deaths and that we also have 0 gender-based and harmful practices. Over the years in Nigeria, there's been a steady increase in the proportion of people that have been able to be on antiretroviral therapy. But we've seen that consistently we've not done well in the PMTCT sector. We have all the policies, we have all the expertise, we have, at least to a certain extent, funding. It is high time that we walk the talk.
Highlight of the event was the presentation of certificates to participants. In a related development, ASWHAN recently concluded a 4-day training for trainers for adolescent girls and young women on gender-based violence, mental health and wellness. The National Coordinator, ASWHAN, Assumpta Reginald, delivered the opening remarks. Goodwill messages were delivered by guests present, including representatives of UN Women, UNAIDS, NAPTIP, and Network of People Living with HIV.
Some people think that HIV is a thing of the past, but you and I know that HIV has not gone. We're still dealing with HIV. We're dealing with HIV, we're dealing with, even transmission of HIV to newborns. So HIV is still here with us. There's still a lot of work to do. And one of the ways we can deal with it is to actually target vulnerable population. And women and girls living with HIV are one of those vulnerable population we must never, never leave behind. So it is our pleasure to work with you. And I want to commit that we will continue to work with you as long as we exist and as long as we have the resources.
With our support, which we can assure you of, I believe that you make that change. And what is the change we need to see? The change we need to see is that we need to, as much as possible, eliminate all forms of gender-based violence in our communities. We need to ensure that every young person, every woman have access to reproductive health services in all the communities, in all the ramifications that they are. Do your follow-up, ensure that people stay healthy, make sure that mental health is also addressed, because I know that that is a key issue that you have been trained on and an issue that is there. It's not often that people tell you that they have mental health issues, but with the training you have received, I believe that you are in a position to engage with your peers, to engage with others, to know when they have issues, and offer referral, offer guidance as much as possible, so that at the end of the day, people will live their full reproductive health life, people will live and empower and ensure that our country, our community, our states are better than what we made.
The Association of Women Living with HIV and AIDS in Nigeria, ASWHAN, is an umbrella body of over 850 registered support groups of women and girls living with HIV and AIDS across the country.
A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV self-test kit is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or Naca's website. Our services are available to you Monday to Friday every week.
Finally, an empowerment program organized by Naca for vulnerable and key population groups in Abuja. Keep watching.
To tackle poverty and social inequality, which are drivers of the HIV epidemic, the National Agency for the Control of AIDS, Naca, carried out several capacity-building and empowerment programs for vulnerable and key populations in Abuja. The training covered tailoring, beautification and catering, after which certificates and startup funds were given to the participants. A representative of Naca shed more light on the significance of the empowerment program.
This event is actually to build the skills of our young people, especially the key populations. Naca collaborated with Rich Care Foundation to provide free medical tests for the key populations and also to build an empowerment that can help them to be economically built. And we know that poverty is an influencer of HIV. So when they're economically built, they will be able to fend for themselves and they will be able to know their rights and be able to prevent this HIV infection.
The event is very unique in the sense that most of the patients that we have in the course of treatment, they discover that they are fairly poor. And then the treatment, there are some that presently showing up without knowing their stature. And it's good that you know your stature with this training to be able to access treatment if you are ill And then if you are okay, you can be able to perform your duty, which they taught them. And indeed, I'm really surprised. Within 5 days, they have acquired so much skill in the different feature that they have been taught.
Some of the participants shared their experience.
They gave us so many insights towards our health. They taught us about hepatitis B, HIV/AIDS, diabetes, high blood pressure. They won't did our test so that we can know our health status. That this was a major part of the outreach, and not just the medical aspect. We also learned skills. We had some in the beautification group where they learned how to do makeup, tie gele. It was really cool. I was in the confectionery class. I couldn't do so many things before, but now I can do so many things. And I really can't wait to start exploring what I've learned from here. I want to say thank you for this opportunity. Thank you for making Nigeria great. Thank you for being part of the development of Nigeria. You guys are good. You guys are great. Thank you. And I pray for more money so that we'll have this kind of outreach repeatedly so that more people can be empowered. Thank you, Naca. Thank you, Rich Care Foundation. I love you. Thank you for this great opportunity.
Naca has so far empowered about 15,000 individuals across the country, even with limited resources, further reinforcing its unwavering commitment to achieving HIV epidemic control before 2030.
Sister, where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef. He go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thank you for watching. For more on the HIV response, follow us on our social media platforms at Naca Nigeria and subscribe to Naca TV on YouTube for more. Till next week on The Last Mile with Naca, know your status and take action. I am Adesua Suyi. Compliments of the season.